Good morning or good afternoon, depending on where you're joining us. Welcome to
Right.
today's Center for Public Safety and Justice panel on public safety and homelessness, a topic that blends human need, legal rights, and community well-being, and the realities of on-the-ground response needed to address these. We're joined today by exceptional panel representing law enforcement leadership, homeless service advocates and systems, as well as legal advocacy organizations. Our plan today is to do a brief introduction, jump into about 45 minutes of a moderated discussion and questions, followed by an audience Q&A. Those in the audience are able to submit questions through Zoom's Q&A feature. Today we're joined by Sheriff Gonzales, Sheriff of Harris County, Texas, Chief Holloway, Chief of St. Petersburg, Florida, Alan Banks, Community Engagement Associate with Friendship Place based in DC, and Anne-Marie Staudenmaier, Senior Counsel for Washington Legal Clinic for the Homeless. I'll introduce everyone and say, Sheriff Gonzales, wanting to see if you wanted to introduce yourself and tell us what you're looking forward to in this conversation.
Thank you so much. I want to thank you, the other panelists, and the University of Virginia for convening us this morning or this afternoon for a very important discussion. I always say that in policing in the modern era, we're in the front lines of three important issues. That's mental illness, addiction, and poverty. And as the Harris County Sheriff, we see this every day. We see how all these different topics intersect. I am the elected sheriff in Harris County, which includes the greater Houston, Texas region. It's the largest sheriff's office in Texas and the second or third largest in the entire country. And so to me, not only do I have a unique perspective in that I understand the enforcement side of things, making sure we're keeping our community safe from any potential threats out there, but at the same time, I see where our jails are populated with many individuals that frankly shouldn't be in jail. So this morning, for example, 13% of my jail population today, over 1,000 persons are here that are have identified themselves as being unhoused individuals. Many times they get arrested on lower level offenses. They crowd up the jails. It's very ineffective, very costly for the taxpayers, but out of sight, out of mind, people think that something's being done when in reality, there's other ways to do it. I started my professional career with the Houston Police Department, where I served for almost 18 years. Then I did 3 full terms on Houston City Council as a city council member, as well as mayor pro tem for our city, where I was also chair of the Public Safety Committee. And I was able to really dig into public policy and help create different innovative programs that looked at deflections, such as the Houston Recovery Center that's still in place today, and really deflects individuals from the criminal justice system and from incarceration. I look forward to the conversation.
Thank you. Over to you, Chief Holloway.
Good morning, good afternoon, wherever you are, and thank you for inviting me here today. My name's Tony Holloway. I'm the Chief of Police here in St. Petersburg, Florida. We are the 5th largest city in the state of Florida. I've been here now for 11 years. I've been involved in law enforcement for over 40 years. Of those 40 years, I've been a police chief for 18 years. I've served in Clearwater, I've served in Somerville, Massachusetts, and currently now I'm serving here in St. Petersburg. What I'm looking for is almost like the sheriff said, for law enforcement, we can't arrest our way out of this problem. We got to figure out how we bring social services to this problem, because bringing a badge and a gun to every call is not the answer. Is how do we bond together with social service and get these individuals help that they need, whether it's housing or whether it's mental issues. But how is law enforcement, instead of us wearing all these hats, how do we give these hats to other people, other professionals? And that's what we plan on learning here from the other panelists. How can I help not only my officers, but how can I help the community to help these individuals get back on their feet? Because we're all in the same boat. We learned that here from the last hurricane we had come through Florida. We're one incident away from being unhoused. So that's what I want to learn from everybody else here. So thank you again for inviting me.
Thanks for joining us. Alan?
Good day. Alan Banks is my name. I am a person with a life history of homelessness. I experienced homelessness twice for a total of 6 years. I have been serving with Friendship Place for 15 years, so that's more than twice as long as I experienced homelessness. I'm a divorced father of 2 children, or 2 kids. They're not children anymore, they're grown adults. I lost contact with my family for 5 years and 10 months during my first go through homelessness. I'm reunited with family now. And my greatest joy in what I do today and where I am today is reconnecting with my family and making a difference in how people see and think about people experiencing homelessness. And it has had great effect. I'm very happy about the effect that people hearing me speak has had on them. So now that's all I'll say for now. Thank you very much.
Thanks for sharing, Alan. Anne Marie.
Hi, good afternoon. Thanks for having me. Just listening to all three of the other panelists, all of whom have a background in law enforcement, is why I'm so grateful that as a legal services attorney, I've been able over the last almost 30 years to develop partnerships with people in law enforcement. Because Alan and I do a training for our local DC Police Department, the Metropolitan Police Department, that's been going on for 29 years now. It's called Homelessness 101, and it has made a huge difference in uh, how many of those officers view homelessness and view the people that they interact with in their law enforcement capacity who are unhoused. And so it's been incredibly gratifying to me as someone who's outside of that world to see just the dedication that so many officers have to actually trying to help people who are unhoused. And that's why I'm appreciate being here today.
Thank you. Let's see if we can shift a little bit to kind of understanding the landscape of the topic that we're dealing with. Alan, from your vantage point working directly with unhoused individuals, what would you say are the primary safety concerns that you're seeing on a day-to-day basis?
Are you speaking of people experiencing homelessness on the street?
Correct.
Okay. There's a misconception to start with that people experiencing homelessness are criminals and will are dangerous to be around and will harm you if you get a chance. The truth to that statement, or the real way, is that people experiencing homelessness are more likely to be victims of crime than someone who is housed. In Washington, D.C., we have experienced a person who was hacked to death with a machete because they were sleeping outside near the Washington Monument. And we've had people set on fire. We've had, you know, people just harassed for being homeless. I myself was hit in the head with something because I was sitting on a bench at 11 o'clock at night, nowhere else to go. But so a group of kids came by and one of them hit me in the head with something. It didn't kill me or anything like that. I was wintertime and I had on a heavy hood and stuff. But just the fact that somebody would walk by someone and do that to them. Um, I want to go back to what Anne Marie was speaking on. We do that training with the Metropolitan Police Department in DC, and it has made a difference in the way officers approach people experiencing homelessness. And in a nutshell, if you say, hey, you get over here, you set up that person to be defensive before you even get close to them. If you say, sir or ma'am, may I speak to you about something? They're already, okay, what does he want to talk to me about? And that works a lot better than, hey, you get over here. Did that get you?
Yes, absolutely.
Okay.
Anne Marie, you often see kind of the legal and systemic issues that are shaping people's experiences as they live unhoused or unsheltered. What sort of laws or policies have the biggest impact right now on those populations?
Well, in DC, we have a protocol, which is sort of like a law that governs the way the government deals with homeless encampments, people who are living outside on the streets. And unfortunately, over the last couple of years, that protocol that was meant to protect unhoused people on the streets has really been narrowed and is less helpful to people. So right now it says if they're going to clear an encampment, they have to give people 7 days notice. It used to be 14 days notice. They often do, what they call emergency clearings or dispositions in situations that aren't actually emergencies, is just an excuse to clear people off the streets. So that's our protocol. But I would say overall, and this affects the entire country, the Grants Pass case, which was decided by the Supreme Court 2 years ago, a year and a half ago, really changed the landscape and made the law much less helpful and friendly to unhoused people. Because what it said was, and this is from the US Supreme Court, any city in the country, if they don't want to, accommodate people who are unhoused, they don't have to. They can, say they can arrest people for being homeless, basically. And so it really changed the criminalization landscape and made it much easier to criminalize unhoused people simply for their status of being unhoused. So that's the law that I'm most concerned about. And because it came from the Supreme Court, it's much easier for many governments to mistreat people just because of their homelessness.
Sheriff Gonzales, looking at you next, just as the elected sheriff responsible for county-wide public safety, what challenges does your agency face when responding to incidents involving the unhoused?
Yes. It's a big challenge. I think, we've heard already some of the challenges between kind of the legal side and then trying to provide services. And then sometimes we get calls for service where individuals are reporting. Sometimes I call them just nuisance type, quality of life type issues. It is what they just call law enforcement. So I think on the front end, society has put all this burden on law enforcement. By default, I've become the largest mental health hospital in the state of Texas. I shouldn't be that. I'm not designed or equipped to be a shelter, but because it's been easier perhaps to just criminalize behavior, then we're the ones grappling with that. And so it's very challenging for law enforcement agencies. Our deputies aren't equipped to do that. As the chief mentioned, we carry taser, handcuffs, a pistol, and as much training as we could give our personnel. And I feel that we're, as law enforcement, probably as well trained as we've ever been with all the different training programs. It's still not our core competency, if you will. And so I think that, we have to kind of grapple, how can we better serve the individuals that may be in house that come, on our radar. And it's very challenging because sometimes you have addiction issues going on, like I mentioned in my opening statement, and you have co-occurring issues, like what came first? Was it mental health issues or is it some addiction issues? And then you have both. Hospitals don't want to deal with them. They turn them back around. So by default, like I said, I end up with 1,000 persons that, are basically in house that are sitting in our jail. And the daily churn, it's slow to move people through the system. And all we do is just, it's a vicious cycle of revolving people in and out. So, but always remind our personnel, look, just because we wear a uniform and we have a badge, it doesn't mean our humanity has to be checked at the door. There but for the grace of God go I. And I think that we could be outside the box thinkers. That's why we've come up with different innovative programs that I think hopefully better serve people and connect them to the real services that they need. And then, we could make better use of the resources that we have to really combat serious crime in our communities.
Thank you, Sheriff. Chief Holloway, building off that and a little bit about what you said during your introduction, urban police departments often experience high call volume related to homelessness, behavioral health, and substance abuse. What patterns are you seeing, and how often is this truly a public safety issue versus a social service issue?
And thank you for that question. I'm going to echo a lot what the sheriff said there. So first, you got to educate the community and the police officers. Being homeless, unhoused, is not a crime. So that's the first thing you got to tell people. It is not a crime. So it's not a criminal offense. So when you go there, it's like, what problems do you need to address? Is the house situation you're trying to address, or is it a mental issue you're trying to address? But then the officers are not equipped for some of those things. So then you got to figure out what support you can bring, how you can stabilize it, and what resources that you can bring to that call that you're going to. Because people sometimes, they just don't like what they see. They see the person on the street, so they want that removed. Well, that person is not committing a crime. You may not like it, but there's no crime there. So then it falls upon law enforcement to see how we can address that. And what we've done here in St. Peter's, we've created 2 units. One is called the PATH team, Police Assisting the Homeless, and those officers are responsible just for that, because they build a rapport with the homeless individuals, so they know what they need and they know how to address that situation. And then we take away the badge and the gun. We have a thing that's called Community Assistant Life Liaison. And those are the people like Al, they specialize in that. They go and they make contact with those individuals. You need a badge and gun. You need to figure out, like the sheriff's saying, what is the what's the problem, this underlying problem, and how do we help that individual? And that's how you move it along. We've had this program in place since 2002. Those liaisons, we call them, they've gone to 75 calls. They've handled the situation. And the key thing is they didn't have to bring law enforcement to those calls. So like the sheriff, and I with that, like the sheriff saying, we need experts. We don't need a badge and a gun. We need someone that can go and help that person. But and that's what we're seeing. That people they see something they don't like and they don't know how to address it. So therefore, 911 will handle your problem.
Thank you. Alan, I see your hand. And by the way,
Yeah.
feel free to jump in whenever. No need to raise your hand. Just a good discussion going. So go ahead, Alan.
I wanted to piggyback on what Chief Holloway was saying. We had that issue here in DC, in particular up in Silver Spring, Maryland, where people could look down in the subway station and they were seeing people experiencing homelessness, sleeping on the benches and things like that. And that was years ago. And they would call their people, and their people would call the mayor, and the mayor would call the police and tell them, you got to clean this up, you know. Our work with the academies has informed the officers that they're not breaking the law. And you can't just move someone along because they don't have somewhere to go. And that has proved very effective. Anne Marie will tell you they used to get a lot of complaints about the Metropolitan Police Office, how they treated people experiencing homelessness. Today, those complaints have been cut way down, and I got to go back to simply, communication skills. I do want to add one more thing to my bio. I was on the federal side of law enforcement. I was in federal law enforcement and diplomatic security. So I have an understanding of how that kind of stuff will roll downhill to the officer on the street. And that's not happening. Everybody is being taught that what they were taught before was wrong. And I'm done. Thank you.
No, thank you. Moving a little bit kind of towards enforcement rights and realities of the topic. This question is both for Sheriff Gonzales as well as Chief Holloway, but I'll start with the sheriff first. Your agencies are often the first called when someone is in crisis or when encampment issues arise. Can you walk us through what's going through your deputies' minds as they respond to these calls?
Yes. Again, based on our training, and I'm sure Chief Holloway would agree. I mean, I'm just talking historically. We've always been taught or trained to kind of perceive or be alert for our safety. Everything could potentially be a threat. And so many times we're looking at it in terms of mitigating that threat. I'm really happy to see a lot of the evolution, if you will, fourth response models. Here in Harris County, we've been very supportive and it's working really well. Our response model is called the Holistic Assistance Response Team, HART. And the dispatchers now are trained that when certain calls for services come in, if they would be better served by sending a professional staff member that could go out there and address that, like Chief mentioned, what is the underlying issue you're trying to address? Is somebody just loitering, maybe trespassing, talking to themselves, playing the air guitar in a park somewhere? Any of those type of behaviors is how can we send a different response to try to assist and connect the person to the services that they need to make sure that they're well and address any community concern, if you will. We also have a pre-book diversion center that I incorporated into my jail facility where we're working very closely now with the district attorney's office so that when somebody is arrested, then potentially we could screen through the charging information and say, wait a minute, Alan's been through here 20 times already for trespassing. That's a clue that he's probably just unhoused. He might be cold. I'm telling you, it's about 60 degrees here in Houston right now, and it's cold for us. We're not used to that. I'm sure Steve Holloway would agree. Maybe they're just cold and they're going to a business and then they're just trying to stay warm, just a basic human need. We get called out there and a young patrol deputy's like, well, what do you want me to do? Like, well, I don't want him here. Well, all right, let me take you to jail then.
Yeah.
I mean, that's very costly and it's ineffective and we're just going to keep revolving around and around. And so, we also have the other thing that we incorporated back in 2017, and it's a very successful program. We're now teaching it regionally. It's called CORE, the clinician and officer remote evaluation, and we do tele-psychiatry, tele-deputy type program. Now our deputies can go out there, they're equipped with an iPad or a tablet, and they could triage what's going out there in the scene to see, hey, this individual may be bipolar, may be schizophrenic or something. They don't need a law enforcement response. Let me connect them to a mental health clinician. That way they can kind of talk directly, and then let me get some guidance and feedback instead of me trying to make a diagnosis as a police officer out in the field. So that's just a few things. We've got a lot more that we've tried to incorporate. I'm an outside the box thinker. One size doesn't fit all. But while we're still involved in this process, how can we be more, have that human touch, really try to improve outcomes, be a good police executive, trying to make better use of my resources. And look, we have incredible opportunities to be leaders in this space. And how do we use this time? How can we make a positive difference to help continue to move our profession, our respective professions where they need to go, and make sure we're compassionate, but at the same time, making sure that we are being mindful that sometimes the community also, has legitimate concerns. And we can't just discount that. We have to make sure we're also listening, but how do we bridge that gap, as was mentioned, and educating law enforcement, educating the community and others. So that's just a sample of things that we do to try to address this. But sometimes, and again, we've tried to also teach our deputies what to expect when they go out there. We've created more positions for our homeless outreach team, for example, that connects with them. They go in a more simplified uniform without the badge and gun, on their person to just kind of lower that temperature a little bit and connect human to human, develop that human connection. Years ago, and I'll be real quick with this, I was on Houston City Council back in 2013, and we helped launch the Houston Recovery Center. That was a deflection program. It's still in place today, where instead of arresting people for public intoxication, we take them to this facility. It's no frills, but it stabilizes their situation. We call it, for those that may be old enough, we call it the old Andy Griffith model. We basically go and let them sleep it off for a few hours. We don't incarcerate them. We connect them to resources. And even if they're not ready for recovery or assistance, maybe they're not ready. But you know what, Alan, if you understand the recovery process, you may not be ready the first time, but after the fifth time, you say, Mr. Gonzales, you're always compassionate. You always treat me with respect. You know what? I'm ready for that help now. And now, because we have that relationship, and guess what? We've lowered the cost. We've made sure now our officers have more time to go focus on serious crime, and we're truly helping that individual with the core issues that are affecting.
That's helpful. Thank you, Sheriff. Chief, same question to you. I'll just rephrase it, abbreviated in case you may not remember. Can you just walk us through what's going through your officer's mind when you're responding to calls related to the unhoused?
Sure. So I'll just add on to it, the sheriff, because he's covered a lot of great things. And I'm glad the way law enforcement have evolved, because it used to be, if it also responded to a scene, is how do I make an arrest, or how do I get out of this call? That was your two. That was it. That's all you had. I arrest a person, or I figure out how I'm not going to take this call. Now we're bringing resources in is really helping. And we got a lot of programs just like the sheriff's office. What we do is an encampment, like you said, is officer safety first, but we work with one of our hospital, St. Anthony's Hospital, and we take a nurse practitioner out with us twice a week so we can bring the medical care to the individual. What we found out was the hospital also saw a reduction in people coming into the emergency room, and they saw their costs going down. Because most of the time, the unhoused people, they forget to take their medicine. They can triage them right down the street. So, and then it becomes, like Alan said, we know everybody. We know everybody by name. We know, hey, did you take your medicine today? Did you not take your medicine today? And it's giving the officers something else on their tool belt. Taking away the badge, the gun, and handcuffs and the tasers is what resources can I bring to help this situation? Because that officer, he or she is dealing with something short term and they're not solving the problem. So what are you bringing to the long term? So that's what we had to bring in. And that's how law enforcement has been changing. Again, not trying to arrest our way out of this problem. How do we educate our way out of this problem? And how do we bring resources to this problem? And I'm not going to repeat the sheriff said, but we do a lot of the same things. So that's what we see officers. But the old mindset was arrest or get out of or get out of this report?
Sheriff.
Yeah, I'll be brief. The chief said something that prompted an idea. And I think law enforcement, and we're still behind on this, as simple as it may sound, is he made a good point. We still reward or view a productive officer as how many charges have you filed? And the more serious the charge, the better. And how many citations, how many arrests? Those have historically been the metrics that as a profession, because it's simple, we measure productivity. We need to change that. I know I'm trying to evolve to where I measure how many individuals have you connected to services? How many times did you use that fourth responder model? How many times did you connect them to the Houston Recovery Center where they could get real, serious support? And then maybe circle back and saying, hey, Deputy Gonzales, I just want to let you know that this person that you referred, guess what? We got him connected to his family. He's doing well now. He's back on track. Job well done. We typically don't give attaboys for things like that. And I just want to say we need, as a profession, to keep rewarding those things that we want to see more of. Thank you.
Thank you.
Sheriff, if I add on something to that, we did that 8 years ago. We don't ask any more. The question is not how many arrests have you made, how many people do you know in the community, and give names of some of those people. And that's the process when you apply to become a detective.
It's culture.
When you become a detective or you become a sergeant, it's not, don't tell me how many arrests. Tell me how many people you know and tell me what you have done for those people.
Perfect. Yeah,
I tell the officers all the time that you will get to know the people on your patrol route, and you'll know who's good, who's bad, who's living in a house, or who's experiencing homelessness. You're going to know who it is, and then it's up to you to step forward and lend that helping hand. You never know what might help someone get off the street. And the first thing is just that human contact. That's the basis for it all. So, yeah, thank y'all very much.
And Alan and Chief, and I don't know if this is happening in other parts of the country, but we've seen it here in the Houston region, is that we often have what I would call maybe the street population, that they do have a place to stay, but are still coming to commingle with the truly unhoused persons to provide them with low-cost drugs. They keep them addicted and they just hang out all day. And then at the end of the day, they go and go back to their apartment or go back to family, but they're not helping or supporting them. They're exacerbating the problem. So the point about what are our deputies thinking about, sometimes it's like, well, what am I dealing with? Am I really dealing with an unhoused person here, a veteran, just somebody that's having some mental health issues? Or is it someone from the street population that is just hanging out and consuming drugs? Because we've seen that they were smoking or using that kush, and it was low cost. You could even buy it in some convenience stores and they would get high all day and they would just intermix and steal some of the items and monies, the low monies that somebody that was maybe homeless, that they would just be predators, if you will.
I saw that quite a few times during my experience of homelessness on the street.
Yep.
Where I know for a fact people were coming out there just to sell drugs to the people experiencing homelessness. And that, just like you said, Sheriff, at the end of the day, they went back home.
Yeah.
I've seen that.
Anne Marie, looking over to you, kind of from your legal perspective, how do law enforcement actions, ranging from citation to arrest, affect individuals' ability to find housing or access services?
I'll answer that in 1 second, but I just want to say I so appreciate Chief Holloway and Sheriff Gonzales, and in the way that you've changed the paradigm in your jurisdictions. I wish you could train every police chief in the country, because it's still kind of unusual, I think, to have the perspective that you all are teaching your officers. So I just kudos to you for doing that. But in terms of the way that law enforcement activity impacts unhoused people, if you have, an arrest on your record, and a lot of times landlords, employers, they don't look to see what was that arrest for. They just see that you have a record. And even if you just have a citation, even if you get a ticket, if you don't pay that ticket, and most of my clients can't pay even a $50 ticket, then you can get a bench warrant issued. And then you could potentially be arrested just for not paying a fine for something minor, like, open container of alcohol or something. The way that impacts your ability to get jobs, to get housing, to get, even medical help is very severe. Like DC now has a law that supposedly protects people with a criminal record when they're applying for housing and or jobs. But landlords, employers have ways to get around that. And they will figure out if you have a record, and then they'll come up with a pretextual reason for why they're not renting you that apartment or they're not giving you that job. So even though the law changed to protect people with criminal records from, being discriminated against, there are many ways that they still get discriminated against, and it's really hard to capture that. So that's why, and you all already know this. That's why these sort of arrests for insignificant or petty things can really make an impact and will basically keep people in homelessness because they won't be able to get housing or they won't be able to get a job simply because of that ticket or that arrest. So that's what I have to say about that.
Thank you for that. Alan, how do law enforcement actions impact your ability to build trust with clients or those you also continue to serve? Are there examples of strong collaboration or situations where a different approach might have worked better to build trust?
Okay, I will start with the beginning, dealing with the crap rolling downhill to the officers on the street. And we have work to change that. Would you ask the second half of your question again, please?
Are there examples of strong collaboration or situations where a different approach might have worked better to help build
Yeah,
trust?
I can give you an example. This was before I even came into partnership with Washington Legal Center for the Homeless. I had seen the way some officers approach people experiencing homelessness, and some of them were still doing it the old way, but many of them were doing it the right way. For example, I had stopped at a little convenience store and got a bottle of Gatorade, and I was pouring it in my water bottle so I could, carry it easier. Very, you pack for a purpose when you're experiencing homelessness. A couple of officers saw me doing this, and instead of saying, "Hey, you get over here, what are you doing?" They said, "Sir, are you mixing?" And I didn't quite understand what that meant in the beginning, but then I realized I was putting this in that bottle, and I've seen people do it. I said, "No, I'm not mixing. It's just Gatorade." And they went on about their job. So I experienced that personally. I've experienced the other side of that where an officer came up to me at the Silver Spring subway station, screaming and yelling, "Y'all can't be here. I told y'all you can't be here." And I just said, "You haven't told me anything because this is the first time I've been here." So they were just generalizing the homeless community as a whole. They're all one type of person. They're all one group. And if I told one, I told them all. And so that's where we started. And I have seen the change in how officers are approaching people experiencing homelessness. One other thing I want to say before I shut up, you've heard me use the word experiencing. That's a word that I started pushing a few years ago. And the purpose of that word is to take away the identity of people experiencing homeless as homeless people. Homelessness is not an identity. It's something that people go through, be that for 3 months or 6 years like I did. People out west, when their homes burned down, they experienced homelessness. Down in Florida, when the hurricanes come through, people experience homelessness. So it's not who they are, it's what they're going through. That's me for now.
Thanks, Alan. So I'm looking to shift gears a little bit towards solutions and what's working. Before then, want to invite people in the audience to submit Q&As before we get to the Q&A section, so panelists can answer those. Alan, actually sticking with you, what are some of the most promising strategies you're seeing right now, whether that's outreach, coordinated entry, certain shelter models or partnerships that help people move towards stability?
The two best that popped in my head right now is the coordinated entry program, which makes it a lot easier for people seeking services to find those services. When I was on the street and I got to the point of starting to try to work my way out of it, I had to walk all over DC to different agencies. And it was nothing to sit there for 2 hours and then find out when you got to that you were at the wrong place. The rest of your day is shot after that because you have to be back at the shelter in time to get a bed at you have to be in line at 1 o'clock to get a bed at the shelter. The other one is the, well, there's two. One is the communication skills of the officers dealing with people on the street. That has greatly improved. And the third one is being consistent. I was a person before I came into this field that if I offered someone help and they said no, I would never ask them again. But I have learned that because of what they've been through, and I went through a lot of that, they may not trust anybody. They've given up hope. They've been chewed up and spit out by the machine. So you may have to go talk to them and say good morning 10 times before they even say good morning back to you. And then comes the process of trying to get them into services. We have street outreach teams at Friendship Place who go and do this all the time. They were out there during COVID even. We know where people experiencing homelessness are. It's just a problem of getting them to identify that need help and getting them to come in for help. And I'll leave it at those three.
Thanks, Alan.
You're
Anne-Marie,
welcome.
looking to recent court decisions or evolving policies that talk about what cities and counties can and cannot do related to public space uses and encampments. Broadly, how can jurisdictions balance the rights and dignity of individuals with broader community safety needs?
Well, I already talked about the biggest case in this area in many, many years, which is the Grants Pass decision from the Supreme Court. And that definitely changed the landscape of what jurisdictions are allowed to do. But, fortunately, there are jurisdictions like St. Petersburg and Houston that, where they still have law enforcement willing to try to, get their officers to help people rather than, arrest their way out of the problem. That, my fear is that Grants Pass kind of gives law enforcement and mayors, et cetera, carte blanche to do whatever they want. But there are so many bright spots on the horizon. DC, for instance, as much as I, fight with the DC government on a daily basis, they do offer, shelter for people, especially, we have an actual law. We're one of the few jurisdictions in the country that has a law that says if the temperature is freezing, they have to provide shelter space for people. That doesn't exist in most parts of the country. So it's really, depends on who's in charge there. We have a Housing First program here, which many, many jurisdictions do now. But, 20 years ago, that wasn't even a concept. Housing First means, you take people from the streets and put them in housing rather than, make them stay on the streets or make them kind of languish in shelter. And once you get people into housing, the other issues that they're having, whether it's addictions, mental health, general physical health issues, often resolve themselves because having a home is honestly the best thing you can do in terms of healthcare, general healthcare, mental health care, addiction care. Giving somebody their own space that's safe and that they can control is really the best thing you can do for many people who are unhoused, and it resolves a lot of other issues that might otherwise cause them to get in trouble with law enforcement.
May I tag along with that?
Absolutely.
Housing First is the program that I was connected to that got me off the street. And again, it's better to have someone in their own place where they control the lock on the door, and then they can start getting their life in order. That's a safety net for them. You can't do it from living in your car. You can't do it from a friend's couch. You definitely can't do it in a shelter. I tried to do it in the shelter. When I first started my journey to rebuild my brain, I was learning tremendous tools at the VA to use to manage my illness. But I was leaving the program at the hospital and going right back into the shelter, and I had to go into shelter survival mode. And that's, it's like you're in prison. to tell you the honest truth, in some shelters. And that was in the biggest shelter on the East Coast the second time. And, it was incredibly wrong. So once I got out of the shelter, I was able to apply all those tools that were given to me to help me keep my life in order, get my life in order and keep my life in order. And that's the biggest thing about that. I wanted to also touch on some legal rules, anti-homeless rules. I think it was in Florida that they had a law that you can only serve so many sandwiches to a group of people experiencing homelessness. I'm not sure if it was Florida, but they arrested a couple because they served one sandwich over the limit. Architecture, anti-homeless architecture. I don't know if you have it where you are, but if you come to DC and you look at all the benches and things like that, you will notice they've got these nice little handrails on them or separating sections on the seating area. That's so people experiencing homelessness can't lay down on there. In our subway system, they have put in these situations where if you relax on the bench, you will fall off. It's angled so you will roll off if you go to sleep. There are so many things in place that people who have no idea what's going on don't see. But if you've been there, you see and you know what you're looking at. It's anti-homelessness architecture, what I call it. And I'll stop.
Thank you, Alan, and thank you, Anne Marie. Sheriff, your agency has been at the forefront of homeless outreach, making a lot of national news headlines in your approaches. Can you talk more about the Harris County Sheriff's outreach teams and what's working well?
Yes, thank you so much. I want to just support the housing first model. There's a local organization that I've worked with for many years now. It's called New Hope Housing, and they provide really good housing model where there's support services and everything. And
Yeah.
Alan made a good point that I don't think can be overlooked. He said, I have to hurry up because I have to be back in line and get into the shelter by 1 o'clock.
Yep.
The limited shelter space there is many times is not user friendly. If you're not there by a certain time, yet we're telling people, oh, you got to catch public transportation to go, get a job. First of all, did you get a chance to shower and get ready and get dressed? Where do you leave your belongings? There's all these different factors. That's why housing really is important. One of the programs that I'm very excited about that's really worked well for us, it's called Employee to Empower. It was something that's award winning now. It was launched by one of our local commissioners, board of supervisors, if you will. He's a former sheriff, similar track as I did. They work closely in collaboration with unhoused individuals and those that are ready for making a change or evolve their situation. They get them a living wage. They help get them into housing. Part of that work week also includes some training opportunities where they could connect them to social services. It's a holistic approach, and many of them have found success, end up getting housing, end up transitioning to stable work beyond that. And at the same time, they help with beautification projects and other thing, again, for a living wage. That program, Employee to Empower, has been really good. I spoke about the Houston Recovery Center. That's been really good as well. We do have the co-responder model as well. We've had that for many years where we pair up a deputy with a clinician so that when they go to those calls for service, there's that more, again, a holistic approach, not just a law enforcement perspective, but more of triaging the situation. I mentioned the fourth response model. They've been very helpful where now we could divert individuals directly that are professional, clinician, social service type background to go help individuals with the issue that's going on instead of sending law enforcement. It's good for us because we could go take care of more serious things, but it's also good for the individuals because we're truly connecting them to the services that they need. Those are some of the programs. There's others that we're trying. Again, one size doesn't fit all. So, we're not afraid to borrow from programming from Chief Holloway or others. That's how we all get better. And hopefully others can learn from us as well. We're an approved Department of Justice training site where individuals come here to learn different models that we've tried that are working. And we also want to continue to help evolve, our learning from other jurisdictions as well. I've made a note with what the panel has mentioned about the training for law enforcement. I think that's something we could benefit from. So we're going to see how we could incorporate that as well.
Alan, yeah.
Sheriff Gonzales, I want to thank you for that very much. And I want to speak on our employment program at Friendship Place. When people come to us, we don't sit them in the classroom and teach them how to work. We know that everyone has employable skills. So what we do is get them a job. We get them in stable housing because you can't have one and not the other and make it work. As the sheriff was saying, if you can't take a shower, they don't want you there very long. If you don't have, if you're working and don't have a place to live, or you have a place to live and no job, you can't pay the rent. So it can be a mess out there. Thank you very much, Sheriff.
Yes, thank you, Alan.
Sheriff, if I could also follow up a little bit, you mentioned the aspect of training.
Yeah.
Over your career, how has the training of officers to kind of deal with those experiencing homelessness evolved over the years that you've seen?
Look, since the 1990s, I think Memphis was really the trailblazer when it came to this. And then in the early 1990s, my home agency, I grew up in the Houston Police Department, which is our local municipal police department. We began in earnest trying to learn more about crisis intervention training, which in the past, before that really wasn't done. And so that really became a new movement. And I think law enforcement has really done well to incorporate a lot of that training, not always perfectly. There's flaws and it requires a lot, but I think we've done much better to train individuals. One thing we've also incorporated in recent years has been to add the ABLE training that came out of Georgetown as well, to de-escalate and duty to intervene in situations, to try to really push the de-escalation. As Alan stated, law enforcement gets out there and we might just start barking orders and all that because, we're amped up. We through our training, and we had individuals with lived experience that would come, and maybe Alan, would attest to this as well. It's saying, I was disoriented. It's middle of the night. I'm homeless, and then you come with all these loudspeakers, 3 or 4 different commands being given. Raise your hand, lay down, throw. They're yelling, screaming. You got lights blaring. All these different, things happening. How can we better approach individuals to make sure we're safe, but also making sure that we're, engaging with the person in the most appropriate way. And so we've also added our Project A Guardian, which teaches our deputies specifically on how to better serve those on the autistic spectrum as well. So it's specific to that. And now even some households will give them a sticker that's specific to maybe a household that says someone in this home is on the autistic spectrum. That way, we respond to a call for service. Our deputies know right away, because sometimes somebody with autism may be drawn to colors. Well, sometimes our tasers may be a bright color. But guess what? They're going to go grab that taser, not to cause harm, but just because they're drawn to it. So let's prepare our deputies for what they may encounter. And so we have that, and also Project Lifesaver, that really those families that perhaps have someone that's, grappling. I know my family had some history of dementia and Alzheimer's that may be wandering off or become lost. We want, again, our deputies to be equipped, knowing that there's equipment out there that could safely return the individual home. It's about taking a holistic approach and understanding that sometimes the reason I joined this profession was because when I was growing up, my father couldn't read and write. He was illiterate. And I learned right then and there at a young age that sometimes people just need a navigator, which is somebody to help them navigate complex situations, which is in a way what we're all doing. Us in the law enforcement arena, and then our partners here through advocacy or the legal, quagmire that's out there of how do you navigate all these issues and restores people humanity and dignity. And so how can I be a navigator to really help, as a police executive, bring these different teachings and programs so that when my deputies encounter a situation, they've seen or heard of this before, they understand to hopefully approach with more compassion and resolve it for the good of everybody. And so, again, I think that we have a unique opportunity when we're in these seats, these respective roles, to really make a positive difference, impact our profession in a positive way, and really lift people up, and really help make sure that at the end of the day, everybody has their dignity. As you said, when Alan says, you just ask them a simple question instead of just yelling at him. And so again, we there's one size doesn't fit all. And every jurisdiction, the politics may be different, all these different factors. But as leaders, we can try to figure out what best works for our local municipalities.
Thank you, Sheriff. Chief, looking to you, in your experience, what does true collaboration look like across police, service providers, and advocates? And what approaches have you or your agency taken?
For us is first is being real-time communication, transparency, and willing to adjust so you can bring the right resources to the needs of the community. And what I mean by that is just our police officers, our victim advocates, our social services, we sit in a room together and we plan together, not a policy, but we plan together. What are we going to do? The sheriff said something earlier, we said navigators. Our victim advocates, our call team, we call those people our navigators. Who's going to help navigate that person through the system and what do they need? And we sit down at the table and we'll say, okay, this is Alan. What does Alan need? And everybody's sitting around the table. Does he need food? Does he need clothing? Who's going to do that? At this table, who can help Alan? And then the next person, next person. So you're having everybody sit down, not working in silos. Knock those damn silos down because you're causing your own problems. Let's figure out what we're going to do to help that individual and have everybody sit at the table. So that's true collaboration. And that's what we do. Once a month, we say we go through our client list. That client, what are we doing for that client? Not moving that client around, but what resources are we bringing to that client so we can get that person off the street and give them the help they need? Because, and like the sheriff said, we have a great sheriff here also is we can't arrest our way out of this because I can put that person in jail, but guess what? They're coming home, they're coming back, and you
30
haven't
days later.
they've gone for 3 days, but day 4, they're right back and you're starting all over again. So that true collaboration is everybody working together, checking your egos at the door, and what are you doing for that client and what are you doing for the community to solve the problem? Not short term, long term.
Thank you, Chief.
Ego is one of the things we had to conquer in DC. For the longest time, every organization was working separately to solve the problem of homelessness. They wanted to be da 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 da. And finally, they realized that we all have to work together to get this done. You may do something that we don't do. You know, we may do something that you do. So working together has really helped in DC area.
And I think, and let me add it, is fighting for the dollars. Put all the dollars in one pile and because we don't need to compete for it. The same money with the same people. So put it in one pile and figure out how you're going to work with each other.
Yep.
In sort of a kind of rapid fire closing, 1 to 2 minutes max, looking ahead in the next 12 months, what is one realistic, actionable step folks can take to increase and support both public safety and stability for those experiencing homelessness? Wanted to see if we could start with Anne Marie.
Well, my mantra is housing, housing, housing. That's the way we're going to resolve homelessness. And so, this isn't a law enforcement problem, but governments have to, come to terms with the fact that the reason that homelessness is going up, despite all of these programs that they come up with, is that there's not enough money devoted to just deeply affordable housing. Even if it's like a one room, people need housing, and not all, but many of the other problems that lead to interactions with law enforcement would go away if we were able to just get people into housing quickly. And the money is there. It's all about priorities.
Thank you. Alan?
For me, it's community engagement and education, which is my main focus at Friendship Place. I have seen the effects of people being shown a different view of homelessness, people being educated about the causes and how hard it can be to get out of it. I have seen those things. I specifically know of 2 situations where it changed somebody. One young lady that I spoke to, she changed her major to social work after hearing us speak. Another young lady who I worked with when she was in the 4th grade came back and interned for us. And I didn't remember, but she remembered me. And not just she remembered me, she remembered the contact and the information that we exchanged. So education and just community engagement, let everyone know that 99% of us are one or two checks away from losing everything, you know. The voice of the homeless community has changed over the last 20 years. At one time, you had to be a bad person to experience homelessness. Even fall down drunks had somewhere to go and sleep tonight. Today, because of what we went through back in 2008, 2009, people who were working and doing everything right, you know, the company they were working at went out of business. Now, both of them are experiencing homelessness. They've got mortgage they can't pay, car payments, college tuition, a lot of things they can't pay now. They have a different voice, and that voice is now added to the community of homelessness. So people will hear them where they won't hear a poor person, if that makes sense. And that's it.
Thank you for that, Alan. Chief
You're
Holloway,
welcome.
looking ahead, what's one realistic, tangible step we can take to both support public safety and stability for those experiencing homelessness?
Education, educating the community and educating the officers on what is homelessness and what is and is not a crime, and getting both sides together so we can solve this problem together.
Thank you. And to you, Sheriff.
For me, it's about partnerships. I think that at the end of the day, no one entity can really truly be effective at addressing what could be a complex issue. One key tangible thing that we're doing here is establishing a community hub. I think Chief Holloway touched on it a little bit, but we're borrowing kind of from the Chelsea model in the Boston, greater Boston area, where different stakeholders come together to address specific needs that are going on that they're seeing in their community and see who can best address those needs, whether it be finding them a medical home, housing, employment, things like that. And you also have to look and make sure that we're not the law enforcement or advocates or whatever at the table, and we forget to include and give a seat at the table for people with lived experiences that could better educate us on what they need and would best support them instead of us trying to tell them what they need.
Thank you, everyone. Thank you to Alan Banks, Anne Marie Staudenmaier, Sheriff Gonzales, and Chief Holloway for your insight today. And thank you to the audience
Very
for engaging
welcome.
thoughtfully with this important topic. This conversation, to me, reinforced that homelessness and public safety are deeply interconnected issues, and progress requires collaboration across systems, sectors, and communities. Thank you for tuning in to the final panel for the Center for Public Safety and Justice 2025 panel series, and keep an eye out for next year's Thought Leadership Series.